Welcome to Olive Branch Church, where our mission is to create a vibrant community that emphasizes enrichment, excellence, and fellowship. We are so excited that you have tuned into The Word Made Plain with Pastor Dr. Vincent L. Windrow Sr. today. We hope that you're impacted, empowered, and enlightened through the Word of God. Let's join Pastor Windrow as he delivers today's message.
Well. Welcome, people of God. Welcome. Somebody say amen. The other person, listen to the other person say amen. Then you say amen. Welcome to the Olive Branch Church. We are delighted that you have tuned in once again to the Word Made Plain Bible Study Edition. We say BSE for short. This is a very, very exciting time in the life of our church as we continue to develop protocols and processes to get people back in the pews, saints back in the seats. We are delighted that once again it is Bible study time, but we're not actually going to have Bible study tonight. We have a very, very special presentation and a very, very special guest. But before we get to the special presentation, before we get to the special guest, please allow me a space of time to go through a couple of church announcements. Remember in the old church, we used to have somebody stand up, and they used to, Kawanda Robinson was the announcement girl. She used to do the announcements when we were in Antioch. She used to get up and, I'm doing the announcements now. So please, ma'am, please, sir, it's the women's conference. I'm talking about it's starting tomorrow night, 7 o'clock. It's the women's conference. What is it? It's Renew, Rebuild, and Restore. That's tomorrow night, 7 o'clock. How can you tune in? OBC TV in our YouTube channel and Olive Branch Church Facebook. Olive Branch Church Facebook and OBC TV, that's our YouTube channel. 7 o'clock, everyone is welcome. So 7 o'clock tomorrow night, 7 o'clock Friday night, and then Saturday kicks off with workshops and seminars and discussion sessions. So please, ma'am, please, sir, tune in. Got it? Good. Don't forget, not this Sunday, but the following Sunday. I'm talking about the 23rd. I'm talking about 5-3. That's May 23rd from 6:30 to 8:30. The Nashville location, the Murfreesboro location coming together in Smyrna, Skate Center, Smyrna. We have the whole entire skating rink. Yes, I'm coming in with a mink to the roller rink. Yes, I'm gonna be hot in the summertime. So 6:30 to 8:30, the entire roller rink, skating rink. Is it the roller rink? Bethany, is it the roller rink or the skating rink? Not the roller rink. What's a roller rink? Before your time? Thank you very much. Bethany said it's the skating rink, not the roller rink. Good. So parents, youth, everybody, come. It's on the house, it's on the church house. Come and be festive and fellowship, and let's celebrate our children moving out of this academic year, chilling for a minute, but then getting right back in the swing of things so that they don't lose what they've learned over the summer. So, got it? May 23rd, that's next Sunday, May 23rd from 6:30 to 8:30. Good. Hold on, let me see what else. Oh, did I say thank you to the Fish House in Murfreesboro, Tennessee last week? Once again, our partnership with the Fish House in Murfreesboro, JoJo Herbert, proprietor. The Fish House in Murfreesboro, our partnership, through that partnership, we distributed 300 fish, hot fish, whiting. That's old school, that's whiting. Some of y'all don't even know ocean perch. Do y'all remember ocean perch? I remember we used to buy, my grandmama and them used to buy ocean perch frozen, and then of course they thawed it. Right. You don't unthaw it. If you unthaw it, that means you freeze it. Thaw it means that it's frozen, you thaw it, it's no longer frozen. But some of y'all are saying unthaw. I don't know if that's what you really mean. I think what you mean is, I can't read your mind, but I think what you mean is you're thawing it. But you say you're gonna unthaw it. Yeah, I'm here to help. So back to the Fish House. Thank you so very much, JoJo Herbert. If you're in the Murfreesboro area, I'm talking about Laverne and Smyrna and Murfreesboro. I'm talking about Las Casas and Eagleville and Shelbyville. I'm talking about Christiana, all down through there. Would you go to the Fish House and support the Fish House and JoJo Herbert, the proprietor? Once again, next week, next month, Bethany, when do we distribute the hot fish plates? The first Tuesday of the month at our Murfreesboro location. That's 1115 Minerva Drive. Good. So, special. I'll be right with you now. We received a special thanks from Brian Jenkins. Now, Brian Jenkins, he has the Chosen 300 in Philadelphia, Pennsylvania. We partner with him for our feeding program in Guyana, South America, and we've been supplying food to that community for 13 years now. And so he sent a special thanks for our continued support. So please, ma'am, please, sir, I know you may never meet those believers in Guyana, in that community, but I want you to know that your contributions, that your prayers, your support, they continue to make a difference in the lives of our people there. Amen. I'm almost done. I'm almost done. So, on tonight, we have a very, very special presentation. On tonight, we have a very, very, very special guest. And as a part of our continued pursuit to get us healthy, we have to talk about ways to get us healthy. How do we live a healthy lifestyle? And what does a healthy lifestyle have to do with the abundant life that the Lord Jesus Christ said that he came for? He said that I have come that you might have life and that you may have it more abundantly. I'm talking about overflowing, a different level. It is hard to be a witness unto the Lord. It is hard to go and spread the gospel when you can't get out of the bed, right? When you're struggling in your bodies. So what we want to do, we want to live healthier lives, not just for the sake of living healthier lives to say we're healthy, right? But so that we can spread the gospel, so that we can help feed folks, so that we can support the folk in our community. So on that note, please join me in welcoming to the stage Elizabeth Hart. She is the director of the Office of Faith-Based and Community Engagement, which is part of the Tennessee Department of Health. Come on, Olive Branch, wherever you are in Lafayette, Louisiana. I'm talking about in Biloxi, Mississippi. I'm talking about Baltimore, Maryland, Des Moines, Iowa. What's the city in Idaho? What's the city? Boise, Idaho, wherever you are, come on, put your hands together and let us welcome to Olive Branch Church, Elizabeth Hart. It is so nice to have you.
It is so wonderful to see you and to meet you and to talk to your congregation. And thank you so much for having me. As you mentioned, this is incredibly important for us to get the word out, not only to your congregation, but the entire Nashville area. And for anyone that's watching online, as you mentioned, they might be in Idaho or Louisiana. It's important that they also get this information and, of course, to get vaccinated.
Absolutely. That's the name of the game. So the title of this show is Let's Talk About Vaccines. So we already know that about 36% of all the folk in the United States have been fully vaccinated. That's like 117 million people. But it's not all the people.
Correct.
That means we still have some work to do. And there still remains these health disparities. And so we want to make sure that we continue to inform our communities and to inform our folk about healthy and healthier living.
Absolutely, and you mentioned the percentage in the country, and here in Tennessee, 30% of Tennesseans are fully vaccinated, which is a great job for 30% of Tennesseans. That equals about a little over 2 million Tennesseans, because there are about 7 million Tennesseans here in the state.
Is it?
So a little over 2 million have actually been fully vaccinated. Now, we are at 30% herd immunity, and I'm sure many of you have heard about that term over the last 15 or so months. We need to reach 80% herd immunity for all of us not only to feel safe and be kind of returned back to a sense of normalcy, but to offer many of us protections from COVID-19. We're at 30%, and we need to get to 80. And how we're going to do that is with your help. By you getting vaccinated, by you coming to the church. We're going to be talking about that here shortly, about a vaccine event. But anywhere else here in the city of Nashville or the state of Tennessee, any of the local health departments, you can get an absolutely free COVID-19 vaccine, and we'll get into that in just a moment.
So let me ask you this. So why is it, so we're at 30%? So for people of color,
yes,
where are we?
So of the a little over 2 million, so I think it's 2.04, 2.04. Don't quote me on that. I know it's a little over 2 million.
2 million. I wrote down 2 million.
We'll say 2.
We'll
stick with the 2. Of those 2 million, 11% are Black or African American. So we also have a ways to go in our community, in our communities of color, Black and African American, as well as our Hispanic brothers and sisters. They hover around that 3% of herd immunity, or individuals who've been vaccinated. And so we have some work to do. We know that there are historical reasons why there is a mistrust, why individuals don't want to get vaccinated.
So we're not imagining this.
No, absolutely
not. This is real stuff. We have real reasons to be skeptical.
There are, and so, one of the things that we always want to talk about when we have these conversations that we've had over the last about 6 months since the vaccine's been out, is what we know are social determinants of health. The reasons why our communities, the Black community, our Black and brown brothers and sisters have been more disproportionately impacted by COVID-19. We talk about education and environment. We talk about, adverse childhood experiences. We talk about all those things that kind of play into how we are raised and how healthy we are. And because of that, chronic diseases, diabetes, heart disease, all of those things are part of the reason why our communities were disproportionately impacted by COVID-19. So as of today in Tennessee, we have 855,000 plus cases of COVID-19 that are confirmed as of today.
I'm talking about right now.
As of literally about an hour ago, we updated the numbers. Of that, 12,296 individuals, unfortunately, have succumbed to the virus. That is 12,296 families that have had to bury their loved ones and experience that loss. And that is 12,296 too many. We know that. And so one of the things that it's important that we get the vaccine is that we can slow that spread of those deaths. We also want to slow the spread of individuals who were hospitalized. So as we just talked about, our communities, we are disproportionately impacted because of chronic diseases, heart disease and diabetes. That also leads to hospitalizations. And if anyone has ever been in the hospital, no one wants a heavy hospital bill after you get out, right?
Right.
And we've probably heard anecdotally about people who have this, the long symptoms after you've had COVID-19. Those also are become costly, and they cause you to, of course, miss work and other things.
Oh, you ain't got to tell me.
And you know how you can stop that? You know how you can prevent that?
Tell me now.
Getting the vaccine.
That
COVID-19 vaccine is going to prevent those hospitalizations. It's going to prevent deaths. So there are 3 vaccines that are out there on the market here in the country. We have Pfizer, we have Moderna, and of course we all know about the Johnson & Johnson. And we'll talk about Johnson & Johnson in just a moment.
So if you get the vaccine,
yes, sir.
Ms. Hunt, if you get the vaccine, if you are enduring this extended COVID effect,
yes,
will the vaccine help you in that? So I had to. I contracted COVID last March.
Oh no!
Right? Oh yes.
Oh goodness.
Oh yes.
But thankfully, you are still here.
I am still.
Amen.
Here, sister.
Yes.
And I think that there are some long-term effects.
Yes.
Like before I had COVID, I had bangs. And as you can tell, I know it ain't funny. So why is she laughing at me? Are you laughing at me or with me?
I'm laughing with you.
I'm not laughing.
I'm going to cause you to start laughing. Well, what we do know, on a more serious note, is that the vaccine is going to help prevent if you were to get COVID again, right? It prevents serious illness. We know that the efficacy, so that is the how much it's going to help prevent, and the safety of the vaccine is extraordinarily high for all 3. We know that with Pfizer and Moderna, I think it's 95 and 94%. That is extraordinarily high risk of reducing the risk of getting COVID-19. So what we are trying to do is encourage people to get that vaccine, to encourage them to prevent them from getting sick, prevent them from going into the hospital, and of course, preventing them from passing away or succumbing to the virus. We know that our communities are impacted a great deal. Of that 12,296 deaths that I just mentioned, 17% of those are African American. Now, why is that important? So remember that number, 17.
17%.
We are 17% of the total deaths in Tennessee. We only make up 17.1% of the entire population of Tennessee. That is an incredibly high number of a rate for African American deaths when we only make up 17% of the entire population of this state. Of the cases that I just mentioned, the 855,587 cases confirmed as of today, we make up 13% of those cases. Once again, we are 17.1% of the entire population. That number is extraordinarily high when we make up such a small percentage of the state's population. So let me go back to the Johnson & Johnson. I said we were going to put a pin in that. And I know there's been a lot of conversation lately.
And controversy.
And controversy, of course, about the Johnson & Johnson. Let me explain why what they did by pausing it is a good thing for public health. It means that our surveillance systems, they're working. At the time of the pause, 7 million doses of that vaccine had been administered at that point in time to Americans. 6 individuals were found to have adverse reactions. That is 6 out of 7 million. And I could pull my calculator out, but I believe it's 0.00005, I think. Something, maybe 4 or 5 zeros. My point of saying that is it was a very, very small percentage. That means that our systems are working. They're looking for those anomalies, right? They're looking for anything that was just a little bit off. And when individuals get a vaccine, they are reporting that you can, if you have any adverse effects, that you can report those. We want to know about those. Sure. If you experience anything, that's exactly why they put a pause, because the system is working. They then found through investigation and a whole lot of paperwork for those individuals who were identified to find that it was safe for it to go back on the market for individuals to continue getting the vaccine, because the risk of getting COVID-19 was much greater, exponentially greater than the slight risk of a side effect from the vaccine. So it is extraordinarily safe. It is extraordinarily high percentage of preventing illness. And so that is also on the market. So you've got Johnson & Johnson, you have Moderna, and you have Pfizer. Now, the Johnson & Johnson is that one shot that we've all been hearing about.
One and done.
One and done.
One and done.
You get it and you're good. And then the Pfizer and the Moderna are 2 shots. And so you'll get the first one, and then one of them you have to wait 28 days to get the second one, and the other one, I believe it's 21 days before you get the second shot. With all 3, Pfizer, Moderna, and Johnson & Johnson, you are not fully vaccinated as soon as you get that immunization. And I think a lot of times we see on social media, people are excited about getting the vaccine, which is great. And they say, oh, I'm fully vaccinated. Well, not quite.
Hold up. Yeah, right.
So it takes about 2 weeks for that to build up into your system so that your body is now being able to protect yourself and build up that immunity to make sure it can combat the virus if you happen to come in contact with somebody who has the live virus. And so we always recommend individuals that once they get their vaccine, still continue to do everything that you had been doing previously before you receive the vaccine, and then wait those 14 days. Then you can technically say you are fully vaccinated.
Gotcha. So with the Johnson & Johnson.
Yes, sir.
That percentage
it's super low.
It is super duper low.
Super duper.
And so those 6 people, and so if I'm worried about being number 7, yeah. Help me, because there once upon a time there were 2 people, then there were 3 people, then there were 4 people, then there were 5 people.
And I believe
I don't want to be number 7.
Absolutely. And one of the things that we tell individuals all the time, always consult with your healthcare provider. Always. Your situation, your health history is going to be different than mine. That's going to be different than the crew that's running the camera and the audio today. Everyone's background is different. And we always encourage individuals to talk to their healthcare provider, talk about their concerns, their questions. Ask all the questions. If you have additional questions, talk to your public health, your local health department. There are people like myself who can, not myself, I'm not a trained medical professional, but there are others that are nurses and doctors and the like who can actually help you and answer those questions and help you feel at ease.
So you've been in this industry, in the health industry for a number of years.
Yes, sir.
So when you say, and I think it's a wonderful suggestion and recommendation, I think it's great advice and guidance. When you say we always tell people to talk to their physician, what we know is that people of color don't always have one of those.
That's right.
So how do we help them? How do we support them in that regard?
Yeah, so there are community health centers all across the state. We have wonderful federally qualified health centers that are here. One not too far from here, the Matthew Walker Comprehensive Health Center is here in Nashville. They are a wonderful partner of ours, as well as Connect Us. There's Neighborhood Health. And I'm dropping those names on purpose because those are entities where individuals can call and actually talk to a provider. You can actually walk into those facilities and receive a vaccine as well. You can walk in tomorrow tomorrow, and I'm sure they would love to see you and say hi to you and give you a vaccine, and there are individuals there who can answer their questions. So if you do not have a physician and you don't have a healthcare provider, that's okay. Walk into one of those centers that I just mentioned. Walk into your local health department. There are individuals who are medically trained, have all the acronyms behind their names, who are able to answer those questions and talk to you about your needs regarding the vaccine.
Gotcha.
So that should never, ever be a barrier. And that's one of the things about COVID-19. We are trying to eliminate any barrier for anyone to not receive the vaccine, right? So if they don't have a physician, okay, not a problem. We'll get you someone who can talk to you about your situation individually. If you have transportation needs and you can't seem to find transportation, whether it's a bus or Uber or Lyft or a church van,
sure.
We are here to help. And if there is an individual who's watching and who's a member of your church, I encourage you out there in the web world to contact your pastor, and he can get in contact with our office, and we want to make sure that that is not a barrier to that individual getting a vaccine.
Oh, that's great. Bringing down all the barriers,
Absolutely.
Eliminating all the barriers is one of the keys to ensuring that people have access
Absolutely.
to these vaccines.
And we also do these vaccine events, as I know we just mentioned a moment ago, that we're going to be having one here at the church in a few weeks. And we want to make sure that we're bringing the vaccine to people, right? So if the church is going to come, if the congregation is going to come to their church, instead of going to a clinic or
Sure.
going to the Nissan Stadium when they had it about a month or so ago, they're going to trust you and they're going to trust your staff. And so we want to make sure we come to them to a safe place where they feel comfortable to get the vaccine. And I think that they'll appreciate seeing your smiling face here as well.
I think that's a wonderful approach to increasing the number of people, not just in our church, but in the community who received the vaccine. So Moderna, Pfizer, I'm a recipient, my wife and I, we received the Pfizer when we were here at this Nashville location several weeks ago. The Moderna vaccine was administered.
And did you have any side effects afterwards? Did you have any symptoms?
Well, I was a little weary after the first dose, not the second one. I was a little weary, and I felt off, right?
And you know what? That's okay. And I asked you that question on purpose because there are individuals who are a little hesitant because of what they might receive as a side effect. And that is actually your body reacting to that vaccine and building it up into your system. So that's actually okay. And if you probably recall, you probably only had it for maybe a day, maybe two at the max.
Absolutely.
Yeah.
Right.
And everyone varies. I had no reaction whatsoever, but I have plenty of colleagues who I've worked with for many, many years, even in the public health department, who had reactions. And so everybody's body is different.
Right. Excellent point.
Yeah.
Excellent point. So Pfizer, Moderna, and Johnson & Johnson, one and done with
is
the Johnson &
Johnson. And so one of the reasons that the Johnson & Johnson is amazing is that for individuals, who may or may not be able to get off work a second time. We're trying to make these events on the weekends sometimes or after hours, but for individuals who just cannot do that, or for college students, our individuals perhaps who are experiencing homelessness, so our transient community, they are prime individuals to receive that one and done, as you mentioned, of Johnson & Johnson. But anybody can get it as long as it is available. And I want to make sure I mention this a couple of times. The website for the Tennessee Department of Health is covid19.tn.gov. From there, you can get access to so many different other websites. So that's the first website I wanted to mention. The second website that's extraordinarily important is vaccinefinder.org. Vaccinefinder.org is how you're going to find the nearest location to you. You just put your zip code in, and you can actually tell it. If you're somebody who really wants the Johnson & Johnson, and you say, I just want to get it out the way, one and done, you can actually put that in vaccinefinder.org with your zip code, and it'll tell you what location is nearby that has it.
Oh, wow.
Yeah.
Now, let me ask you this. Is that just the Department of Health facilities, or
No, that is anyone. So
anyone.
CVS, Walgreens, Walmart, Publix. I'm naming Kroger. I'm just kind of going through some of the ones that I can think of. But any
Does
facility.
Junebug's juke joint? You think Junebug has it yet?
Probably not.
Okay.
They may. I won't say no, but they probably not. They probably aren't approved to actually administer vaccines. So we would, of course, make sure that you're going to an approved site.
Because we don't want any bootleg vaccines.
We really don't. So I would really encourage individuals either to come here to your church, if for those that are here in Nashville area, when we do have an event, so more information to come on that, or to go to vaccinefinder.org and put in your zip code. And that, again, goes back to your web audience. As we mentioned, they could be in Louisiana or Idaho. That's for anyone, wherever you are. If you are listening or watching this particular this forum tonight, go to vaccinefinder.org, put your zip code in, and find the nearest location for you.
Because that's the thing. Regardless of which vaccine you receive, the point is get vaccinated.
Yeah, it's super, super important. And I mean, this is a critical part that we're in right now. So one of the things that we know is early on, there were lines and lines and lines. Everyone was wondering, when am I going to be eligible?
Right,
when can I get it?
Right.
Because there wasn't the supply that we have now. So now we've entered into this phase of, okay, everyone who really wanted it, they've got it.
Mm-hmm.
You've got it. Mm-hmm. I've received it. And obviously, a little over 2 million Tennesseans have. Now we're in that area where there are individuals who might have more questions. Mm-hmm. Everyone's heard in the last couple of weeks about vaccine hesitancy. We mentioned a little while ago about vaccine hesitancy in the Black and African American community, and we know that there are historical reasons for that. Not just Tuskegee, not just Henrietta Lacks, but years and years of lack of trust with government and medicine and science. And that's part of the reason why my job is so important. And our team in the Division of Health Disparities Elimination at the Department of Health, we are a huge team that we are going out and we are telling these stories. We are educating individuals, and many of us look just like you and I. So we have multiple people on our staff who are African American. We have an Hispanic engagement coordinator, and he is working diligently with our communities and our Hispanic brothers and sisters and speaking in Spanish and making sure that they feel comfortable as well, providing that education about the vaccine, because that's why it's that important. We are walking the walk and talking the talk.
So let me applaud you for those efforts, and those types of intrusive campaigns make all the difference in the world, because someone can come on a television show or on the news and say, we got these vaccines, y'all come on down here, without understanding the complexities of people's lives, right? So to not just have a campaign, but to have a type of campaign that goes to where the people are, and not just requiring the people to come to where you are, is so very foundational to success in something like this.
So it's interesting that you brought that up. Because of the virtual world that we've been in for the last 15 or 16 months, I have found myself at 8 o'clock in the morning in Chattanooga, and by 9 o'clock I'm in Memphis. Now, in ordinary times, I could never travel from Chattanooga to Memphis that quickly. And so we have been spending our time going from Zoom to Zoom, Teams to Teams, WebEx to WebEx, having conversations with congregations just like yours, and answering those questions about the vaccine, how to get the vaccine, whether or not what has been happening, what's the data showing. You know, we at the Department of Health, I mean, we even took it a step further. And so about a year ago, we formed what's called the Health Disparity Task Force. And this is a statewide task force where we have individuals from all walks of life, both as individuals, nonprofits, faith leaders like yourself, elected officials, where we are trying to combat these disparities that led to a disproportionate impact on our Black and brown communities, but also in our rural communities as well. So we are not only taking the COVID-19 and addressing it, but we're taking it a step further, because what we do know in public health is, well, I hope that the next pandemic does not happen in my lifetime. We are preparing for because we know that they do come back around, right? And we need to address those disparities that we know that exist. So the chronic disease, the mental health, the infectious diseases, all those things, that's the work that we're doing at the Department of Health.
And what struck me in your signature line is your name, it's your title, it's the office that you work in. And then under Office of Faith-Based and Community Engagement is Division of Health Disparities elimination.
Absolutely.
Not just decrease, not just make smaller, but elimination. And that has to be the goal.
Absolutely. We are working ourselves out of a job.
Good for you.
We will have done a great job if we work ourselves out of a job. And that's exactly what we are doing. You know, we're tackling it from all different angles. Again, as you mentioned, I'm at the Office of Faith-Based and Community Engagement. I'm the talker. I'm going to go out to the community. And then we have our Office of Rural Health Access, so our friends and neighbors who are in those outlying areas. So you mentioned Rutherford County earlier, and that Smyrna and that Murfreesboro area. We also have the Wilson County and Williamson County. So anything outside those major metropolitan areas. And then of course we have the Office of Minority Health, and who does all things minority health related. And so we are a multi-pronged approach in our office. And you mentioned a few minutes ago about a campaign. So I'd be remiss if I did not mention this wonderful campaign that we have just kicked off. Actually, many of you will start seeing ads in the next couple of weeks on both over the air, and if you're on Facebook or use Google for anything. It's called the Our Voices campaign. And you and I spoke before this began about your story and a story about another colleague of yours. This is our opportunity, and I say our as a Black woman, and I take this very seriously. So as you and I spoke earlier, I have been in communications for about 17 years. And one of the things that we know is that our community sometimes gets lost in the historical perspective of a pandemic or other things. And so this is an opportunity for us to tell our stories. How has COVID-19 impacted our lives? Did you receive the vaccine? Were you hesitant about getting the vaccine? Who encouraged you to get the vaccine? How did your life change over the last 15 years? We want everyone to tell their story, no matter how young. Although if you're younger than 18, please make sure that your parent has given you permission. For everyone to tell their story about how COVID-19 has impacted their life from all different industries. We have a website called ourvoicestn.com. It's real simple, ourvoicestn.com. It's a fillable form. You can upload your information, upload your favorite selfie. You know, we were gonna take these professional photos, and we said, no, we wanna see people in their real self. Right. So upload your favorite selfie, and we will tell your story to the masses across the state and across the country. You never know who's watching to hear your story.
And our stories are so powerful.
They are.
Here at Olive Branch, we talk about the needfulness to tell our stories. That's right. Because when we don't tell our stories, other people get to write the story.
Exactly.
And oftentimes we're written out of the story.
Exactly.
Our contributions, our struggles, our sacrifices, our victories, all of that. So you can't leave it to anyone else to tell your story. So we have to lift up our voices and sing our stories.
And absolutely. So when an individual...
Lift every voice
Here we go.
and sing till earth... Bethany, what's the next part?
Oh, Lord.
Heaven ring.
So yes, it is important for individuals to upload their stories. I do not alter their stories. Now, I will go through it and make sure just the small grammatical changes, but I upload it in that person's tense. So if they are writing it I, me, that's exactly how it's going to be on the website. We want to tell thousands of stories across this state of our Black and brown brothers and sisters. And so it's not just our Black and African American communities, it's our Hispanic communities, our AAPR, our Asian American Pacific Islander communities. We want to make sure that these stories are told across the state. And as I mentioned, you never know who might be watching and reading your story. And you might actually be able to help someone. By doing this, again, as you mentioned, it's our opportunity to tell our stories. I wanted to mention a couple other things as well, as I mentioned the campaign. Also wanted to mention that it's important that individuals or parents are keeping their children up to date on their regular childhood immunizations. So you have regular immunizations that actually kind of took a back seat. So if you remember, March 5th was when we actually announced our very first case. Can you believe it? March 5th, 2020 was our very first case. And what's today? May 12th? and we are still going. And so because of when the pandemic started, And then, of course, schools were out, and then you were out for the summer, and we were on lockdown. Many parents did not go to their pediatricians to get their children their regular vaccinations, the regularly scheduled vaccinations, that kindergarten, as at 5th grade, I believe, or whatever the other grades are. And because of that, we have fallen behind, and not just Tennessee, so it's not just us, it's across the country. Many young people have fallen behind on their regularly scheduled immunizations. And if we have learned nothing from this pandemic, it's the importance of making sure that we get those vaccines. We kind of laughingly say in public health, we are doing our jobs well because we haven't heard about a polio in America in a very long time.
Come on, somebody.
You know why we haven't heard about polio? It's this little thing called a vaccine.
Absolutely.
And so it's important that our young people are still continuing to get their regularly scheduled immunization. So if there are any parents that are watching this, please, I encourage you over the next couple of months, especially over the summer before the fall arrives and students are back in school again full time, it's important that you contact your pediatrician, or you can call your local health department to get those immunizations and make sure that they are up to date on those immunizations. If you have any questions about that, of course, call your local health department. You can always go to our website, which is tn.gov/health. That is our main website for all things other than COVID, and where you can get information about that. The other thing I also wanted to mention was it's important that women who are pregnant, there have been a lot of questions. Should I get the vaccine or should I not if I'm pregnant? The answer is unequivocally yes. Get the vaccine if you are pregnant.
The sister's pregnant. So is it a little pregnant? Is it a lot pregnant? Does it matter?
You can be a little pregnant or a lot pregnant. We want you to get vaccinated.
Okay.
And part of that reason is, of course, when that baby is born, because as we mentioned, as of today, which I don't think we haven't mentioned. We're gonna wait. We're gonna pause for that one.
Yes.
What we know is that young babies can't get the vaccine, but the mother can pass some antibodies to that baby. It is incredibly important for pregnant women to get that vaccine, and it is safe. They are constantly doing research. One of the things about COVID-19 is this is the most watched vaccine in history. That's how we were able to put that pause on Johnson & Johnson. All the eyes, all the ears, all the brains are focused right now on this vaccine because we want to get past this pandemic. And so because of it, all the research that's coming out is showing it is safe. It is incredibly safe for those pregnant women to get the vaccine. So I want to encourage, if there's any individual who is watching this, whether you're watching this live or you're watching the replay, I am encouraging you, if you yourself are pregnant or you know someone who is pregnant, please encourage them to get the COVID-19 vaccine. And as we mentioned a few minutes ago, if you have any questions whatsoever, contact your healthcare provider, or you can contact your local health department and someone can answer those questions for you.
Oh, I did not know that. Yes. I did not know that. And now we have some breaking news. Breaking news here, right here at the Olive Branch News Desk. We have some breaking news. Take it away, Elizabeth.
So a couple of hours ago, we did make the announcement in the state of Tennessee, those individuals who are between the ages of 12 and 15 are now eligible to get the Pfizer vaccine, which is incredible. I know there are thousands and thousands of parents who are wanting to get their children vaccinated, but they couldn't because at the time, as of this morning, the lowest of the age was 16. But now individuals 12 to 15 are eligible to get that vaccine. So if you are planning for your child to go to summer camp, if you're talking about going to travel this summer, that is another reason why it's important to get that COVID-19 vaccine. And we talk about travel, and I mentioned that just now, that is another benefit to getting the vaccine. As you and I spoke before this began, I have family all over the world. I have my brother and my sister-in-law, my niece and nephew, they live in London, and I have not seen them. This is the longest time I've gone without seeing my family. And it was important that I get vaccinated. Why? So I can see my family, so that we can all travel again and feel comfortable getting on those planes. Still wearing a mask if we're in those tight, areas with people who may or may not have been vaccinated, but we can now travel and feel comfortable doing so. So that's another reason why. If you're a traveler like me, and I have not had a stamp on my passport in 15 months, and it is killing me softly. So if for no other reason, that's why I got vaccinated.
One of my anxiety points is that more and more people have been vaccinated,
Yeah.
and people who aren't vaccinated will see all these millions of people who are vaccinated and say, well, I'm good now.
Yeah.
But and so one of the things that stresses me about where we are in the process is that more and more people will contract the virus and die. So we have these 3 vaccines. They have high efficacy. They are safe, and yet we still have to get more and more people. I just was talking to a colleague earlier today, and he was telling me about this sister whose mom died. Right, she died. So they went to the funeral. The sister's husband contracted the virus at the funeral and is now in ICU. So we just can't let up, people. We can't become lackadaisical.
Yeah.
We can't become lax. We have to continue to lean in. And if you have been vaccinated, and I pray you have been because you have been given many opportunities to, if you're vaccinated and you are, there is someone you know who is not vaccinated.
Yep.
There is someone you know, and I want to encourage you. Now, if you are torn up over Johnson & Johnson, go get something else. But the key is to get vaccinated, and not just for yourselves.
That's right, absolutely.
Be a good neighbor.
Absolutely. We always say that you're getting the vaccine for yourself, for your family, and your entire community.
Absolutely.
The more individuals who get vaccinated, as I mentioned at the top of the hour, we are at 30%, and we need to get to 80. By the time we get to 80, that'll offer that protection wall for those. There are people who can't get the vaccines for a multitude of reasons. We want to make sure that we're protecting them, but we also want to make sure we're protecting one another.
Sure.
As I'm sure everyone has heard in the news, there are a variety of variants that are showing up here in our country, but of course overseas in other countries.
Brazil, South Africa.
And India as well. And India is experiencing something just absolutely horrific right now with an outbreak of cases and deaths. And so what we are trying to do is we're trying to build up that herd immunity to protect, again, yourself, your family members, and your entire community. If you have a grandmother or a grandfather or elderly parents or a child who has immunocompromised conditions, or you yourself might have diabetes or heart disease that we mentioned before about chronic diseases, that's reason enough to get that vaccine. It's gonna help protect you and all those around you. Summer is approaching, even though it doesn't necessarily feel like it outside.
No, not on today.
But summer is approaching you, and that means barbecue season.
That's right.
I spent several years in Memphis, and I tell you, I think I know barbecue pretty well. And in order for us to gather around together, to have that yummy barbecue or the hot chicken here in Nashville, it's important that you're vaccinated.
What about chitlins? Do you eat chitlins?
So I like hot chicken and I like barbecue. I'm going to leave it at that. But in all seriousness, we talk about the vaccine, and that is incredibly important. That is top of mind. That should be your number one priority. I make myself available for anyone that has questions. And again, I am not a trained medical professional. I've been in communications and medical and public health, medicine and public health for 17 years. But I'm happy to not only answer any questions that someone might have, or get you close to someone else who can answer that question. So please reach out to your pastor who can get in contact with me, and I'm happy to assist. Now, in the meantime, as we're still waiting to get the vaccine, so Pastor will tell you, as soon as I walked into the building earlier, what is the first question I asked you?
Are you vaccinated?
because I walked up to the building with my mask on. My mask is sitting over there in the pew. And that's the first question I asked is, are you vaccinated? Because then I felt comfortable because you've been vaccinated long enough, and I as well, for us to sit here and have this conversation. So it's important that if you are out in the public, we're going to the grocery store, you're going to other places, you don't necessarily know those folks and whether or not they're vaccinated. So you want to continue to protect yourself and protect others. So of course, continue to wear your mask when you're in public, at, large spaces, right?
Okay.
To wear your mask. And the other thing that we've been talking about for years and years and years and decades and centuries, the importance of washing your hands.
Will you please wash your hands? Can you do that? Can you wash your hands?
Yeah, those are three of my favorite words in the entire English language.
Wash your hands.
Because washing your hands prevents so much. It prevents the spread of any germs and diseases and illnesses. Watching that you make sure that you're not touching your face. But I really, really cannot impress enough about making sure that you're washing your hands on a regular basis. If you touch a doorknob, go wash your hands. If you shake somebody's hand, wash your hands. If you touch an elevator button, we use your knuckle, use the back of your hand. But again, wash your hands, especially before you are eating or drinking anything.
That's excellent guidance. I'm sure we have some questions. Let me pull up some questions. Okay. We have. Okay. Here's a question regarding Johnson & Johnson. I heard Johnson & Johnson is less than 70% effective. So why would people get it versus the other two vaccines other than it's a one and done? Okay,
that's an excellent question to whomever asked that. So 75% is still phenomenal. Let me say it one more time. Phenomenal. Why am I saying that? Because the flu vaccine that you should be getting every year.
Should we get the flu vaccine?
Absolutely. Not even a question about it. You still get your flu vaccine. The flu vaccine every year ranges around the 50% range of combating the flu. We know that sometimes if you get the flu vaccine, it again prevents severe illness. So if you had not received the flu vaccine, you could end up hospitalized, or unfortunately there are many, many individuals who die every year from flu. And so what we know is that particular vaccine is around 50% every year effective. 75% is phenomenal.
That's 50% more.
That is
phenomenal.
That is phenomenalist. I'm going to start using that. That is an incredibly high percentile. Do not waver on whether you're going to get it or not get it based on that number, right? 75% is extraordinarily high. And of course, the 94 and the 95% respectively for Pfizer and Moderna are off the charts high. And so all three are safe, all three are effective. Whichever one is available to you, get it. If you have a preference and you want to get the Johnson & Johnson, get it. There is plenty of vaccine here in this state. We have a plethora of vaccine that is available, which is different than it was about 2 or 3 months ago when we had a shortened supply. There is now plenty of vaccine in this state, and so there is absolutely no reason why an individual should not be able to get vaccinated. I'm going to repeat the websites a couple more times. COVID19.tn.gov, that is the main hub for all the data, all the things, all the blogs, all the videos about COVID-19 here in the state of Tennessee. That's COVID19.tn.gov. If you want to find a vaccine closest to you, you're going down the street and there's a Walgreens, vaccinefinder.org, find out if they have vaccine available, and then you can make an appointment. And the third website, as we talked about that campaign, it is so critically important for our communities to tell our stories, and that's ourvoicestn.com. It's a fillable form. You can upload your information and your story, and of course, your favorite selfie.
Thank you so very much. And thank you, Tracy Brewer, for submitting that question.
Thank you, Tracy. That was a great question.
So here's one from Mark Walker. What are the differences in side effects from each vaccine provider or each vaccine? And is one more severe than the others?
No, as you and I talked a minute ago, everyone's body is different. So did you receive Moderna or Pfizer?
Pfizer.
So I also received Pfizer. So isn't that interesting that you had some symptoms
Yes.
and I did not? So there really is not a difference between all three. It really is kind of your body and how it reacts to the vaccine, actually building up your immunity in your system. And so there really, to answer that question, there really isn't a difference. I could tell you that you might have some side effects for one, but then you might not get it, right? So we always tell folks that, to anticipate maybe feeling not so hot, maybe that first day. If you work in a job, you might want to think about, whether or not you're going to take that day off. Or I've received mine on a Friday on purpose so that I had the weekend to recover should I have any side effects, and then I didn't have any at all. And so again, it's very, it's different from one person to the next. So I wouldn't be able to answer that other than to say the side effects will be about the same no matter which vaccine you get, but you won't know until, of course, you get the vaccine.
Thank you so very much again, Mark Walker.
Thanks, Mark.
Here's a question from Daphne Smith. What's the track for next child age group for? So we've just entered into 12 to 15,
12 to 15
for the Pfizer.
Yes.
So is there some type of prediction or thinking about younger children, children younger than that?
And so there are trials that are continuing. I mean, those, and I also want to mention that Meharry, right here in our backyard, are working on different trials and vaccine trials. And those people who volunteer to be a part of those trials, they're actually helping all of us because they put themselves ahead of us to make sure that the vaccine is safe, right? And so there are trials that are continuing. There's research that's continuing to be done. So for Daphne, thank you for that question. I would say stay tuned as the next group of children either are approved or not approved. We do not know. We go through a series of groups who look at that data. So there is the folks that are at the federal level, and of course at the CDC, who look at that data. And so I would say stay tuned. So whenever the next grouping is, it could be next to 9 or 10 years old or even lower. We don't know it yet at this point. So stay tuned on that. But I love that you asked that question because that must mean that you're interested in getting your child or at least a child in your family vaccinated, which is great. So yeah, stay tuned. Of course, we will make all those announcements on the Department of Health Facebook page and our social media. So if you're not following Tennessee Department of Health, go to your search button on your Facebook and click that like button, and you will get all the most up-to-date information about COVID-19.
Good. Thank you. So Emily Johnson wants to know, do we know yet how soon we'll need booster shots?
We don't know. So as I just mentioned, there is still continuous research. They are preparing for the potential of a booster. So you want to be ahead of it and not wait until you find out that you need the booster. So they're in development right now. And so as the research and the data shows, and again, all those individuals who have been in those trials for much longer than the rest of us, then they'll determine whether or not a booster is necessary. So stay tuned more on that. And, here's the thing that, we want to remind one another, we kind of joked about it earlier, about it's been 15 months. 15 months ago, we did not know about COVID-19.
How about that?
15 months ago, we had no idea that 12,296 Tennesseans were going to succumb to this virus. So as we continue to learn in public health, as the researchers and the scientists are working day in and day out on the COVID-19 vaccine, but also studying those individuals who are ill and looking at those side effects, looking at the chronic diseases that we talk about, more information will come out. And so I would encourage individuals to find reputable sources. And I would be remiss if I did not say this as well. I'm going to repeat myself. Find reputable sources. I know everyone loves Facebook. I love Facebook. I love Instagram. I love Twitter. It is important that you find reputable sources. So the Tennessee Department of Health, your pastor, he can provide the most credible information for you regarding both vaccine and COVID-19. please try to stay away from the random shares on Facebook from non-credible sources.
And I think it's a tendency, a proclivity among people. We get in our groups, and somebody done heard something from over here, somebody done heard something over there, and before we know it, we have created this narrative that really doesn't support our health success.
That's right.
But keeps us in this space where we continue to succumb, or at least we continue to be more vulnerable than others as it relates to disease.
That's right. And as you mentioned earlier, in the Division of Health Disparities Elimination, we're working ourselves out of a job. And so we are working to combat those disparities so that we can also reduce the COVID-19 cases. As you know, as we know, we don't know when this is going to go away.
Right.
But you know how it can go away even quicker? Getting that vaccine.
Get the vaccine. And here's a question from Kevin and Chris Dilworth. Which vaccine will be given at the Murfreesboro location? We'll let that be our last question.
Okay, so the Johnson & Johnson will be available at the Murfreesboro location. When we have an event, I believe we're looking at Saturday, June 3rd. I think right before this we went live tonight. We just confirmed that date. And June 3rd. So we will make sure that there is plenty of Johnson & Johnson that is available. Your pastor has a link for you to upload your information to register for that event, and we'll make sure that we send that to him again and get that out to the entire congregation. So please make sure you register for that. But today is May 12th. You don't have to necessarily wait till June 3rd.
Don't wait. Go get vaccinated.
If you have time between now and then, get vaccinated. Because if you get vaccinated today, so Memorial Day is the 29th or the 30th. It's on its way. If you got vaccinated today with that Johnson & Johnson, you'll be fully vaccinated by Memorial Day. About time. I'm doing the math. Around that time.
Sure,
so
absolutely.
If you made an appointment tomorrow, you might almost be completely fully vaccinated by Memorial Day. If you got the Johnson & Johnson, as of course, if Moderna and Pfizer, you need 2 shots, and that's going to take more time. But if you go ahead and get that Johnson & Johnson today, and there is Johnson & Johnson available in the state, in this area, and again, go to vaccinefinder.org to find the nearest location.
So what if people say, you know what, Pastor Benny, I done sit up here and I done listen to this lady, and she makes a whole bunch of sense, and I feel that she is on my side. She got this title, she has this experience, she has a heart in it. What if I say, you know what, Pastor Benny, I hear you, I hear her, but there is something in my mind regarding Johnson & Johnson. Will we have? Is it possible to have either Moderna or Pfizer there?
Yeah, so what we'll do is we'll work with the provider. So there's a whole team of us that come to these events. And so there are individuals who are working parking, there are individuals who are working the registration, there are individuals who have to insert all that information into the computers. And then of course we have the nursing staff who are actually administering the vaccine itself. And so what we'll do is we'll work with the provider and see whether or not we can offer both. Because if we offer the Moderna or the Pfizer, what happens is there needs to be a second shot. And so which means we'd have to come back a second time. And so typically with these events, we like to use the Johnson & Johnson because we were able to get that one event taken care of. And so I tell you what, more information to come. As we get closer to the date, we'll work with our provider and find out whether or not what vaccine they will provide on the 3rd. But we will definitely have an event on the 3rd, and we will keep you posted on which vaccine. But again, do not wait till the 3rd. You can go and get your vaccine tomorrow.
Get busy. Get
counted in this number. That 11% African American, let's get that up to 12, 13, 14. I'd love to see it up to 20%. We're at 2+ million Tennesseans that are vaccinated. You want to be part of that next group, and we announced that 3 million Tennesseans have been vaccinated. So please make sure that you get your vaccine. And if you have any questions, as I mentioned earlier, please talk to your healthcare provider, talk to a local health department official. They can answer your questions. And if you're still hesitant, you know what? It's okay. You can take that time. Do your research. Look up credible sources. Find out your actual questions and what is your hesitation, and then talk to people like myself or other people at the local health department so we can answer those questions, so we can help encourage you to get that vaccine. And I always tell people, just turning one person that was a no, turning it to yes, is a success.
Yes.
And we've had many of those over the course of the last couple of months. People who were very adamant about not getting it. Once we pointed them in the right direction of credible sources of information and talked with them about their concerns, and then they decided to get the vaccine. And we could not be more proud of those individuals turning from a no to a yes. So I hope to turn some no's here at this congregation to a yes, and I hope to see several hundred of you on June 3rd at the Murfreesboro location as we vaccinate individuals.
So a couple of months ago, we had those 2 Moderna events, and you came, you brought people, you brought your friends and your family, you were personally vaccinated, and then you came back. 96% of those who received their first dose came back for their second dose.
Wonderful.
So we are excited about the opportunity to help other people. You know what Paul said. Paul said, just don't think on your own things, think on the things of others. Okay. Just don't be so inclined and so exclusive in your thinking about yourself, but draw the circle wider to include your neighbor, your peers, your colleagues, your first cousins on your mama's side, everybody. This needs to happen, and the only way it's going to happen, the only way we're going to reach 80% herd immunity is for more of us to become vaccinated. And so Olive Branch, come on, put your hands together and let us thank Elizabeth Hart from the Tennessee Department of Health, the Director of Office of Faith-Based and Community Engagement. Thank her for her time. Elizabeth, thank you so very much for being here with us.
Thank you for having me, and you are such a champion, and we appreciate people like yourself who are championing their congregations to get vaccinated.
Absolutely. Olive Branch, I'll see you on Sunday at 10 o'clock, but before Sunday, don't forget the Women's Conference. I'm talking about tomorrow night, OBC TV YouTube channel, and then also Facebook, Olive Branch Church Facebook page, 7 o'clock. Ooh, we got this sister all the way from Oakland, California. Fire. You're going to love this. She is going to minister. I'm talking about she's going to minister your wig off. She's going to minister your weave out. I'm talking about you're going to love this sister all the way. I'm talking about all the way from Oaktown, Oakland. Is it Bethany? Is it Oakland for real? Yes. And what her name is? Dr. Jacqueline Thompson's going to be in the house tomorrow night and Friday night, 7 o'clock. You know the deal. God bless you so very much. Have a wonderful evening. I'll see you tomorrow night at 7 o'clock. Friday night at 7 o'clock. Go to those seminars and workshops on Saturdays, and I'll see you right back here, 10 o'clock, Sunday morning. God bless. Good night.
You've been listening to The Word Made Plain with Pastor Dr. Vincent L. Windrow Sr. Thank you for tuning in, and we'll see you right here next week. For questions about this broadcast or general questions about our church, call us at 615-941-1268 or email us at churchadmin@olivebranchchurch.org.